If you're over 60 and feel that even taking medications for high blood pressure, the numbers keep going up and down like a seesaw. If you've heard about vitamins but don't know which ones really work or how to take them correctly. If you're afraid that hypertension might cause more serious problems like stroke or heart attack, then this video can completely change your relationship with blood pressure control. I know how frustrating it is when you follow all medical guidelines, take medications on time, but still feel insecure because your blood pressure varies a lot during the day. I also know how confusing it is when you go to the pharmacy and see hundreds of different vitamins, each promising miracles, but you don't know where to start or if they'll really help. And especially, I know how distressing it is to think that maybe you'll need to take more and more medications, increase doses, and still not achieve that stability you so desire. But today, I have news that can transform your life. There are 7 specific vitamins, with solid scientific studies proving their effectiveness, that can be your great allies in blood pressure control, especially for people over 60. These vitamins aren't fads or recent discoveries, they have decades of research behind them, but unfortunately, few people know how to use them correctly. What excites me most is that these vitamins don't just help control blood pressure, but also strengthen the entire cardiovascular system, improve circulation, protect blood vessels, and bring other incredible benefits to your overall health. If you've made it this far, it's because you really want a science-based solution to complement your hypertension treatment, so I need to ask you something very important. Subscribe to our channel right now, because here you won't find empty promises or miracle solutions. What you'll find is information based on scientific studies, explained clearly and practically, so you can talk to your doctor and make informed decisions about your health. Hit the notification bell too, because every week I bring new content specifically for people like you, who want to age with health, vitality, and especially with blood pressure under control. Our channel is a community of people who believe it's possible to live fully after 60, using both modern medicine and natural resources that science has already proven effective. If you want to be part of this family that's transforming their own health intelligently and responsibly, subscribe now and let's walk together on this journey. Before presenting the 7 vitamins that can revolutionize your blood pressure control, I need you to understand why people over 60 have different nutritional needs when it comes to hypertension. As we age, our ability to absorb nutrients decreases significantly. The stomach produces less acid, necessary to extract vitamins from food. The intestines become less efficient at absorption. The kidneys, which regulate many minerals important for blood pressure, may not function with the same perfection as decades ago. Additionally, many medications commonly used by seniors can interfere with absorption or increase elimination of essential vitamins. For example, diuretics, widely used for high blood pressure, can cause excessive loss of potassium and magnesium. Reflux medications can reduce vitamin B12 absorption. This means that even a balanced diet may not provide all necessary vitamins in adequate amounts. That's why guided supplementation becomes not just useful, but often essential to maintain stable blood pressure and protect the entire cardiovascular system. The first vitamin that can transform your blood pressure control is vitamin D, but not for reasons you might imagine. For decades, vitamin D was known only as the bone vitamin, but revolutionary research from the past 15 years has discovered it has a fundamental role in the cardiovascular system. Vitamin D acts directly on the renin-angiotensin system, which is the body's main mechanism for controlling blood pressure. When we have vitamin D deficiency, this system becomes dysregulated, causing the body to produce more substances that contract blood vessels and increase pressure. An impressive study published in the American Journal of Hypertension followed 18,000 people for more than 10 years and discovered that those with low vitamin D levels had 30% more chances of developing hypertension, and among people over 65, this risk rose to 52%. Another specific study with seniors showed that vitamin D supplementation for 6 months resulted in an average reduction of 9 mmHg in systolic pressure. Most interesting is that vitamin D also improves insulin sensitivity, reduces inflammation in blood vessels, and strengthens heart muscle, creating a complete protective effect for the entire cardiovascular system. For people over 60, vitamin D dosage needs to be carefully calculated because our skin loses up to 75% of its ability to produce vitamin D through sun exposure. The generally recommended dose varies between 1,000 to 4,000 IU per day, but ideally you should always do a blood test to measure 25 hydroxyvitamin D levels before starting supplementation. The ideal level should be between 40 to 60 ng per milliliter. If your levels are very low, your doctor may prescribe a higher loading dose initially. It's fundamental to take vitamin D with some fat, like a small piece of nut, avocado, or even a drizzle of olive oil, because it's a fat-soluble vitamin and needs fat to be absorbed. The best time is in the morning, with breakfast. Many people prefer vitamin D3, which is more effective than D2. An important tip is that vitamin D works together with magnesium and vitamin K2, so if you're going to supplement vitamin D, consider these other nutrients too. Avoid taking vitamin D at night because it can interfere with melatonin production and disrupt sleep. The second fundamental vitamin for controlling blood pressure in seniors is the B complex, especially B6, B9, and B12. These three vitamins work together in a process called the methionine cycle, which is responsible for controlling homocysteine levels in the blood. Homocysteine is an amino acid that, when elevated, causes inflammation and stiffness in blood vessels, directly contributing to increased blood pressure. People over 60 frequently have deficiency of these B vitamins because the stomach produces less hydrochloric acid and intrinsic factor, substances necessary to absorb these vitamins from food. A study conducted with 2,500 people over 65 showed that those with B vitamin deficiency had homocysteine levels 40% higher and blood pressure 12 mmHg higher on average. When these people received B-complex supplementation for 6 months, besides homocysteine reduction, there was significant improvement in blood pressure, peripheral circulation, and even cognitive function. Vitamin B6 specifically also acts as a mild natural diuretic, helping kidneys eliminate excess sodium. B9, known as folic acid, improves endothelial function, which is the inner layer of blood vessels, and B12 is essential for healthy red blood cell formation and proper nervous system function, which controls heartbeat. The most effective way to supplement B-complex for people over 60 is through a high-potency B-complex that contains active forms of these vitamins. Vitamin B6 should be in the form of pyridoxal 5-phosphate, B9 as methylfolate, and B12 as methylcobalamin or adenosyl. These active forms are more easily used by the body, especially in people with age-related absorption problems. Typical dosage is 50 to 100 mg of B6, 400 to 800 mcg of folic acid, and 500 to 1000 mcg of B12 per day. It's important to take B-complex in the morning because these vitamins provide energy and can interfere with sleep if taken at night. Always take with food to avoid gastric discomfort. If you take reflux medications, talk to your doctor because they can significantly reduce B vitamin absorption. A valuable tip is that people taking metformin for diabetes can also have B12 deficiency, so supplementation is even more important. Some people prefer B12 injections once a month, which can be more effective for severe deficiency cases. The third essential vitamin is magnesium, which is technically a mineral, but is so important it deserves special highlight. Magnesium acts as a natural relaxant for smooth muscles in blood vessels, helping them dilate and allowing blood to flow with less resistance. Additionally, magnesium is a cofactor in more than 300 enzymatic reactions in the body, many of them related to cardiovascular metabolism. People with magnesium deficiency have higher risk of arrhythmias, coronary artery spasms, and of course, arterial hypertension. A meta-analytical study that reviewed 34 research papers on magnesium and blood pressure discovered that magnesium supplementation for at least 3 months results in average reduction of 4 to 5 mmHg in blood pressure. It might seem small, but this reduction is enough to decrease stroke risk by 15%. For people over 60, magnesium deficiency is very common because kidneys start excreting more magnesium, intestinal absorption decreases, and many medications can cause magnesium loss, including diuretics, proton pump inhibitors, and some antibiotics. There are several forms of magnesium available, and choosing the right one makes all the difference in absorption and tolerance. For blood pressure control, the best forms are magnesium glycinate, magnesium taurate, and magnesium malate. Magnesium glycinate is very well absorbed and has a relaxing effect. Magnesium taurate combines magnesium with taurine, an amino acid that also benefits the heart. Magnesium malate is excellent for people who also have fatigue, as malate helps in cellular energy production. Avoid magnesium oxide, which has very low absorption and can cause diarrhea. The recommended dose for adults is 300 to 400 mg per day, but start with smaller doses to assess intestinal tolerance. Magnesium is better absorbed when taken with food and away from medications, especially antibiotics and thyroid hormones. An important tip is to take magnesium at night, as it has a relaxing effect and can improve sleep quality. If you have kidney problems, talk to your doctor before supplementing magnesium. Signs that magnesium is working include improvement in muscle cramps, more restful sleep, and of course, more stable blood pressure. Now I need to pause for a very important question that could change your results. Thinking about everything you've heard about vitamin D, B complex, and magnesium, which of these three options do you feel makes most sense for your current situation? I want you to stop for a moment, reflect on your symptoms, your routine, your biggest concerns with blood pressure, and tell me here in the comments like this. I'm going to start with vitamin D because I feel I need more cardiovascular protection, or I'll focus on B complex because I have memory problems too, or magnesium makes more sense because I have cramps and sleep poorly. Whatever your choice, complete with your personal reason. This exercise is fundamental because when you connect information with your reality, chances of actually putting it into practice increase dramatically. Besides, your answer can help other people in the same situation. So tell me down here, which of these three vitamins resonates most with you? The fourth vitamin that can revolutionize your blood pressure control is vitamin C, but not in the way you've always heard. Most people know vitamin C only as an antioxidant for colds and flu, but it has a fundamental role in blood vessel health that few know about. Vitamin C is essential for collagen production, the protein that gives structure and elasticity to blood vessels. As we age, our natural collagen production decreases dramatically, causing vessels to lose flexibility and become more rigid. When vessels are rigid, the heart needs to pump harder to make blood circulate, resulting in high blood pressure. Additionally, vitamin C protects nitric oxide, a substance that relaxes blood vessels. Without enough vitamin C, nitric oxide is quickly destroyed by free radicals. A fascinating study published in the European Heart Journal followed 8,000 people for 20 years and discovered that those with higher vitamin C levels in blood had 42% less chance of developing hypertension. Another specific study with people over 65 showed that 500 milligrams of vitamin C daily for 8 weeks resulted in average reduction of 7 mmHg in systolic pressure and significant improvement in endothelial function of vessels. For people over 60, vitamin C supplementation needs to be done strategically. Our ability to absorb vitamin C decreases with age, and oxidative stress increases, making us need higher doses. The ideal dosage varies between 500 to 1,000 milligrams per day. But the secret is dividing this dose throughout the day. Vitamin C has a short half-life in the body, so it's better to take 250 milligrams 4 times a day than 1,000 milligrams at once. Prefer buffered forms of vitamin C, like calcium ascorbate or magnesium ascorbate, which are gentler on the stomach and provide additional minerals beneficial for blood pressure. Avoid taking vitamin C with blood pressure medications because it can potentiate effects. It's best to take between medication intervals. A valuable tip is to combine vitamin C with bioflavonoids, like quercetin or hesperidin, which enhance its effects on blood vessels. If you smoke or are exposed to pollution, you might need even higher doses. Signs that vitamin C is working include improved healing, fewer spontaneous bruises, and of course, more stable blood pressure. The fifth fundamental vitamin is coenzyme Q10, technically a vitamin-like compound that our body produces naturally, but whose production declines drastically after age 40. CoQ10 is essential for energy production in cells, especially in heart muscle cells, which work incessantly pumping blood. Additionally, CoQ10 is a powerful antioxidant that protects blood vessels from free radical damage. What most impresses cardiologists about CoQ10 is its ability to improve endothelial function, meaning the ability of blood vessels to dilate and contract adequately as needed. A randomized clinical study with 74 hypertensive people showed that 120 milligrams of CoQ10 daily for 12 weeks resulted in average reduction of 17 mmHg in systolic pressure and 10 mmHg in diastolic pressure. But most interesting is that CoQ10 also significantly improved participants' quality of life, reducing fatigue and improving exercise capacity. For people taking statin medications for cholesterol, CoQ10 supplementation is even more important, as these medications block natural CoQ10 production in the body. CoQ10 is available in two main forms, ubiquinone and For people over 60, ubiquinol is generally preferable because it's the active form the body uses directly, without need for conversion. Our ability to convert ubiquinol to ubiquinol decreases significantly with age. Typical dosage varies from 100 to 300 milligrams per day, depending on hypertension severity and other health factors. It's fundamental to take COQ10 with a meal containing fats, as it's a fat-soluble compound. Many people take it with lunch or dinner. COQ10 can provide energy, so some people prefer taking it in the morning to avoid interfering with sleep. It's important to be patient with COQ10, as it can take 4 to 12 weeks to see complete effects on blood pressure. COQ10 is very safe, but if you take anticoagulant medications like warfarin, talk to your doctor because dose adjustments might be necessary. Signs that COQ10 is working include more energy, less fatigue after exercise, and gradual improvement in blood pressure numbers. The sixth essential vitamin is vitamin K2, a little-known vitamin with impressive effects on the cardiovascular system. Vitamin K2 works by directing calcium to bones and removing it from blood vessels, a process called the calcium paradox. When there's K2 deficiency, calcium accumulates in blood vessel walls, causing arterial calcification, which makes vessels rigid and raises blood pressure. This process is especially common in people over 60 and is one of the main causes of isolated systolic hypertension, where only the first blood pressure number stays high. A Dutch study that followed 4,800 people for 10 years discovered that those with higher vitamin K2 consumption had 52% less arterial calcification and 57% lower risk of death from heart disease. Another Japanese study showed that postmenopausal women who supplemented with vitamin K2 for 3 years had significant reduction in arterial stiffness and blood pressure improvement. Vitamin K2 also activates proteins that regulate smooth muscle cell growth in blood vessels, helping maintain their healthy structure. There are several forms of vitamin K2, the main ones being MK4 and MK7. For blood pressure control and cardiovascular health, MK7 is generally preferable because it has longer half-life in the body and better bioavailability. Typical MK7 dosage varies from 100 to 200 mcg per day. Vitamin K2 should be taken with foods containing fat for better absorption, preferably at dinner. It's important to know that vitamin K2 works synergistically with vitamin D3 and magnesium, so if you already supplement these vitamins, adding K2 can enhance benefits of all. An important precaution is for people taking anticoagulants like warfarin, as vitamin K can interfere with these medications. In this case, it's essential to talk to your doctor before supplementing. Vitamin K2 is very safe and well tolerated, but can take several months to show complete effects on arterial calcification. Foods rich in K2 include natto, fermented cheeses, and liver. But amounts are insufficient for therapeutic effects, hence the importance of supplementation. The seventh and final vitamin that can transform your blood pressure control is omega-3, specifically EPA and DHA derived from fish oil. Omega-3 South are essential fatty acids that our body cannot produce, so they must come from diet or supplementation. They have multiple beneficial effects on the cardiovascular system, reduce inflammation in blood vessels, improve cell membrane flexibility, reduce blood viscosity, and have direct effect on blood pressure reduction. A meta-analysis that examines 70 studies with more than 4,000 participants discovered that omega-3 supplementation results in average reduction of 4 to 5 mmHg in blood pressure, with more pronounced effects in people with more severe hypertension. For people over 60, benefits are even greater because omega-3 also protects against cardiac arrhythmias, reduces triglycerides, and can even improve cognitive function. A specific study with hypertensive seniors showed that 3 grams of omega-3 daily for 8 weeks not only reduced blood pressure, but also significantly improved endothelial function and reduced inflammation markers. The quality of omega-3 supplement is fundamental for obtaining results. Look for concentrated fish oil that provides at least 1,000 milligrams of EPA and 500 milligrams of DHA per dose. Avoid cod liver oils, which may contain excess vitamin A. Prefer molecularly distilled oils, which remove contaminants like mercury and PCBs. The triglyceride form is better absorbed than the ethyl ester form. An important tip is to store the supplement in the refrigerator to avoid rancidity and always take with food to improve absorption and reduce fishy taste reflux. Dosage for blood pressure control varies from 2 to 4 grams daily of combined EPA and DHA. It's better to divide into 2 doses, one at lunch and another at dinner. If you take anticoagulant medications, talk to your doctor because high-dose omega-3 can increase bleeding risk. People with fish allergies can opt for algae omega-3. Signs that omega-3 is working include skin improvement, less joint inflammation, better mood, and gradually, more stable blood pressure. Now that you know the 7 most powerful vitamins for controlling blood pressure in people over 60, I need to teach you how to combine them safely and effectively. I don't recommend starting all at once, as it can be difficult to assess which is working and identify possible side effects. The smartest strategy is to implement one vitamin at a time, starting with those that have most scientific evidence for your specific case. If you have vitamin D deficiency confirmed by testing, start with that. If you have memory problems or high homocysteine levels, prioritize B-complex. If you have frequent cramps or sleep poorly, start with magnesium. Add a new vitamin every 4 to 6 weeks, enough time to assess effects and tolerance. It's fundamental to keep a blood pressure diary, noting values, times, symptoms, and when you introduced each supplement. This will provide valuable information for you and your doctor to monitor progress. There are some very powerful synergistic combinations among these vitamins. Vitamin D works better when combined with magnesium and K2. B-complex works well with omega-3 for neurological and cardiovascular protection. Vitamin C enhances COQ10 effects. But remember, timing is important. Fat-soluble vitamins like DK2, COQ10, and omega-3 should be taken with meals containing fat. Water-soluble vitamins like B-complex and vitamin C can be taken on empty stomach, but many people tolerate better with food. Magnesium is better at night due to its relaxing effect. If you take blood pressure medications, maintain at least 2-hour interval between medication and supplements, except when specifically guided by doctor. Never stop your hypertension medications, even if supplementation is working well. Vitamins should complement, never replace medical treatment. It's crucial that you understand signs that these vitamins are working in your body, but also recognize when something isn't right. Positive effects include more stable energy throughout the day, improved sleep quality, less leg swelling, gradual reduction in blood pressure values, mood improvement, and general sense of well-being. These effects can start appearing between 2 to 8 weeks, depending on the vitamin and degree of initial deficiency. However, some signs indicate need for dose adjustment or discontinuation. If you develop persistent headaches, nausea, diarrhea that doesn't improve, excessive dizziness, or any symptom you didn't have before, stop supplements and consult your doctor. People with kidney, liver problems, or taking multiple medications need closer medical monitoring. Periodic blood tests can help monitor vitamin levels and adjust doses as needed. A fundamental issue I need to address is the quality of supplements you choose. Not all supplements are equal, and poor choices can result in lack of results or even health problems. Look for brands that have quality certifications like GMP, NSF, or USP. Avoid very cheap supplements, as they usually indicate low ingredient quality or inadequate manufacturing processes. Always read labels carefully, checking if vitamin forms are the most bioavailable ones I mentioned. Be suspicious of formulas promising absurdly high doses or combining dozens of different ingredients. Prefer individual supplements or simple, well-founded combinations. If possible, choose brands that provide analysis certificates showing purity and potency of their products. Always buy from pharmacies or trusted stores, avoiding unknown internet sellers. Remember that supplements have expiration dates and should be stored properly, away from heat, light, and humidity. I want to share the story of Mr. John, a 72-year-old retiree who came to me a year ago with uncontrolled blood pressure despite taking 3 different medications. His values oscillated between 170 by 100 and 190 by 120. He had constant headaches, leg swelling, and lived in fear of having a stroke like his brother did. Tests showed severe vitamin D deficiency, low magnesium levels, and elevated homocysteine. We started implementing vitamin D3,4,00 IU daily, and in 6 weeks his levels rose from 18 to 35 Ng per milliliter. Simultaneously, blood pressure started stabilizing better. Then we added magnesium chelate, 300 milligrams at night, and he reported immediate improvement in sleep and reduction of cramps that had bothered him for years. In the 3rd month, we included active B-complex and omega-3. Gradually, blood pressure lowered to values between 140 by 85 and 150 by 90. The cardiologist was able to reduce one of the medications. Today, a year later, Mr. John maintains blood pressure between 130 by 80 and 140 by 85, lost 8 kilos, returned to daily walking, and says he feels 10 years younger. Most important is that he lost the constant fear and returned to traveling with his wife. What impresses me most about Mr. John's transformation isn't just the blood pressure numbers, although they're important, but how his quality of life changed completely. He tells me he returned to having projects, made a small garden in the yard, resumed woodworking hobby he had abandoned, and mainly, recovered confidence in his own body. This reminds me that treating hypertension isn't just about controlling numbers, it's about giving people back the freedom to live fully. Mr. John always says the hardest part was understanding he needed to be the protagonist of his own care, not just passively follow medical prescriptions. And he's right, when we take responsibility for our health and seek knowledge, results are much better. Vitamin supplementation was just a tool, but combined with lifestyle changes and adequate medical monitoring, it completely transformed his relationship with hypertension. For you who are just starting this supplementation journey for blood pressure control, I want you to have realistic expectations and patience with the process. Vitamins aren't medicines that work immediately. They're nutrients that help your body function better, and this takes time. Don't expect miracles in the first week, but don't give up if you don't see immediate results either. Most people start noticing benefits between 4 to 12 weeks of consistent use. It's also important to understand that supplementation works best when combined with healthy lifestyle habits. Continue taking your prescribed medications, eat a balanced diet rich in fruits and vegetables, practice physical activity appropriate for your age, manage stress, and maintain adequate sleep. Vitamins are powerful tools, but they work best as part of a comprehensive approach to health. The most important message I want to leave you today is that you have much more control over your blood pressure than you might imagine. The 7 vitamins we discussed today, vitamin D, B complex, magnesium, vitamin C, CoQ10, vitamin K2, and omega-3, are scientifically proven tools that can make a significant difference in your cardiovascular health. But remember, they should always complement, never replace, medical treatment. Talk to your doctor about these options, show him this information, do the necessary tests, and together create a personalized plan for your needs. Your health is an investment, not an expense. Every healthy choice you make today is building a stronger, more vital future. If this content was valuable to you, if it gave you hope and practical information you can really use in your life, I ask you to show it by clicking the like button down here. This simple gesture helps me understand I'm on the right track and motivates me to continue producing content that really makes a difference in people's lives. Don't forget to subscribe to the channel if you're not subscribed yet, because every week I bring new information about natural health and healthy aging, always thinking about people like you who want to live with quality and vitality. And tell me here in the comments, which of these 7 vitamins are you most excited to try? I'm eager to know about your journey and, who knows, in a few months you might share with us the positive results you achieved. Your story can inspire other people going through the same situation. Until the next video, and remember, your health is in your hands, and you have more power over it than you think.